Now I'm going to review the major medical records that were filed in this case in chronological order so we can see exactly what Dr. Holland did to Phyllis over an 8.5-year period. Here is the Booth Memorial angiogram, as I mentioned. This is where it pretty much all started. At Booth Memorial Hospital, she was diagnosed with a single aneurysm. The report says there is an arterial aneurysm measuring approximately 6 millimeters in diameter, close to the internal carotid bifurcation at the base of the skull anteriorly. Okay, so she was diagnosed with the single larger aneurysm at Booth Memorial Hospital. Dr. Carlin was the referring neurologist, and he then referred Phyllis to Dr. Holland at Mount Sinai Hospital. Now let's take a look at the Mount Sinai angiogram report. At Mount Sinai Hospital, Dr. Holland had an angiogram done of only Phyllis's right internal carotid artery because he was looking to see if there were any additional aneurysms. So let's look at the final result. Impression. Right carotid angiogram demonstrating an aneurysm arising from the supraclinoid portion of the internal carotid artery. There is a small dilatation aneurysm-like at the origin of the anterior carotid artery as well. Okay? This angiogram showed two aneurysms. It showed the original larger one that was diagnosed at Booth Memorial Hospital, and it showed a second smaller aneurysm that was further up on the artery. Now, Dr. Anton, the radiologist, calls it a aneurysm-like. Apparently, they use the term aneurysm for one of a certain minimum size, and this was smaller than that, so he refers to it as aneurysm-like. But the fact of the matter is, once Dr. Holland and Dr. Klein reviewed the angiogram and this report and spoke to Dr. Anton, they referred to it as a small supraclinoid aneurysm, supraclinoid being the region of the brain where the aneurysm is located. So this is definitely a second smaller aneurysm. So the Mount Sinai angiography report showed two aneurysms, the original one that was diagnosed at Booth Memorial and a second smaller one that was further up on the artery. Now let's take a look at the permission for operation record. This was signed by Phyllis and her father for permission for the surgery. It's dated November 12th, 1975. The surgeon is listed as Dr. Holland S., and the procedure that is going to be performed is listed as craniotomy and clipping of craniotomy and clipping of intracranial aneurysm. And it's signed by Phyllis and her father. Okay, nothing esoteric about this. Phyllis and her parents were specifically told by Dr. Holland that she had a single aneurysm, he was going to perform a craniotomy, and he was going to clip it. The implication, of course, being that if the operation was a success, she would be cured of the single aneurysm. Now, let's take a look at Dr. Holland's operative report. The operation was the following day on November 13th, 1975. Pre-operative diagnosis: 1. Internal carotid artery aneurysm at bifurcation. 2. Small supraclinoid internal carotid aneurysm. Post-operative diagnosis: same. So, Dr. Holland in his own report clearly states that he knew about the existence of two aneurysms, and these are both Berry aneurysms, on Phyllis's right internal carotid artery. He mentions the original larger one, and then he says there was a second smaller one in the supraclinoid region. And that's what the angiography report clearly indicated. His synopsis of the operation is craniotomy with clipping and wrapping of aneurysm utilizing microscope technique. Now, Dr. Holland states, let me read part of this report. I'm not going to read the whole thing. It's fairly technical. He says, in the supraclinoid region was a small aneurysm which was felt could thus be handled by wrapping with muslin. Okay, these are Berry aneurysms. In 1975, there was exactly one procedure to treat Berry aneurysms, and that was to clip it. If it doctor does not clip an aneurysm, he better have a good reason, and he needs to explicitly state in his report why he didn't clip it. Dr. Holland gives no legitimate reason. He says it felt could thus be handled. This is a carefully worded statement which explains absolutely nothing. Then he says, after this was done, attention was turned to the major aneurysm. The arachnoid was dissected. He says, after the aneurysm neck was well freed of arachnoid and adhesions, a Heifetz clip was placed across the neck. During the clip application, blood pressure was lowered. So, Dr. Holland clearly states in his own report he wrapped the smaller aneurysm with muslin, which is cloth. He did that first. He then clipped the larger aneurysm, and then while he did that, he lowered blood pressure. The reason he did that is because once he clips that aneurysm, since it's below the other one and it's in the direction of the blood flow, that's immediately going to put pressure on the smaller aneurysm. So he's reducing blood pressure. He wants to make absolutely certain that he doesn't rupture that aneurysm. He also states that he treated the smaller one first by wrapping it, which was mandatory for the reason I just mentioned. So, what do we deduce from the angiography report showing 2 aneurysms and Dr. Holland listing 2 aneurysms as a preoperative diagnosis and stating he clipped one and wrapped one, and the patient consent form clearly stating that a single aneurysm was going to be clipped? Well, we deduce the obvious. We deduce the fact that Dr. Holland lied to Phyllis and her parents, and he told them she had 1 aneurysm when in fact he knew she had 2. He also failed to mention that he surgically treated the smaller aneurysm by wrapping it with muslin. So Phyllis and her family had no idea whatsoever that she had been diagnosed with 2 aneurysms, and she had no idea that a second aneurysm had been operated on. Now, let's take a look at a Mount Sinai consultant's report. It turns out that there was a hospital consultant working on behalf of Mount Sinai Hospital who was monitoring Dr. Holland's activities. You will notice in this report, at the top it says FICU, which stands for Female Intensive Care Unit, and he also says, and this is handwritten, FICU notes. 19-year-old female underwent clipping of internal carotid aneurysm just proximal to the bifurcation and clipping of second internal carotid aneurysm in the supraclinoid portion. Okay. Obviously, he was waiting in the intensive care unit for Dr. Holland to come out and tell him what happened during the surgery. And it's also obvious that Dr. Holland lied to him also. And he just told him he had clipped both aneurysms. The only reason Dr. Holland would have to lie to the consultant and tell him he had clipped both aneurysms is because they had determined from the angiogram prior to the surgery that both aneurysms were to be clipped. In other words, in order to cure the patient of both aneurysms. But we know from Dr. Holland's report that he did not clip both aneurysms. He clipped one and wrapped one, and since he didn't clip the smaller one, that means that aneurysm was still there. Clipping it is the only way to cure it, by sealing the bubble off. By wrapping it, he in fact left it on the artery, preserved it, and delayed its growth, because muslin, over a period of years, becomes part of the arterial wall, and once that happened, the patient now has a single larger aneurysm than they started with, that they have no idea whatsoever is there because Dr. Holland lied to them and concealed its existence. Now let's take a look at the patient discharge sheet that was filed by Dr. Klein. This was on November 25th, 1975. That's when Phyllis was discharged from Mount Sinai Hospital. Discharge diagnosis: subarachnoid hemorrhage due to aneurysm of internal carotid artery on right, and the medical procedure is listed as partial craniotomy clipping of aneurysm. Now, this is when the patient is being discharged from the hospital. Dr. Klein is saying that there was only 1 aneurysm. Obviously, the diagnosis should list 2 aneurysms, and the medical procedure should state that the smaller aneurysm had been wrapped with muslin. Well, it doesn't say that. By creating this document, this is obviously a blatantly falsified document. By creating it this way, Dr. Klein has caused it to match up with the patient consent form. The patient consent form says a single aneurysm is going to be clipped, And now Dr. Klein claims the patient is being discharged after having a single aneurysm clip. My guess is the reason he did that is because these are probably the only two documents that anybody at the hospital may have even looked at. I don't see any other reason why he would doctor this up this way, frankly. If anybody at the hospital looked, they would see the patient agreed to have a single aneurysm clip, and they were discharged after having a single aneurysm clip. Case closed. Standard procedure. Why bother look at anything else? So it appears that these may be the only two documents at the hospital that anybody even looked at, but the fact of the matter is this is obviously a blatant falsification of what actually happened. Now, let's take a look at Dr. Klein's handwritten hospital notes. These were taken at the time of the operation. He says 11/13/75 OR note. Pre-operative diagnosis, aneurysm of internal carotid artery just proximal to bifurcation. 2, second aneurysm of internal carotid artery supraclinoid. So, Dr. Klein also lists both aneurysms as a preoperative diagnosis, clearly indicating that the surgeons knew about the two aneurysms from the Mount Sinai angiogram. Then if we go a little further down, under procedure, he also states the larger aneurysm was clipped with a Heifetz clip and the smaller aneurysm was wrapped with muslin. And he again gives no reason as to why it was wrapped. He doesn't give any reason at all as to why the aneurysm wasn't clipped. You will also notice that he lists all three surgeons here. S. Holland, J. Wancier, and M. Klein. J. Wancier was an intern. He was the third surgeon in on the operation. Dr. Klein was the resident neurosurgeon. That's why he's filing his reports, and Dr. Holland was the lead surgeon. Okay, so it's clear from his operative notes that they knew about the two aneurysms. And again, he gives no reason as to why the smaller aneurysm wasn't clipped. Next, let's take a look at Dr. Klein's dictated medical report. This is dated February 6, 1976, approximately 2 months after the operation. He lists the operation as right frontocraniotomy, clipping of internal carotid aneurysm, wrapping of second internal carotid artery aneurysm. And now take a look at the three surgeons. He lists them as Dr. S. Holland and Dr. J. Blank, Dr. S. Klein. S is apparently his middle initial. Apparently he switches between using his first name's initial and his middle initial, because at the top it says M.S. Klein. Now all of a sudden it's Dr. S. Klein. However, he clearly left out Dr. Wancier, the intern's last name. Now, he knows from his own handwritten notes, which he has reference to, as to what Dr. J, who Dr. J is, and that's Dr. J. Wancier. So this was obviously blatantly left out in an attempt to protect Dr. Wancier. Now let's go down the hospital course. On 11/12/75, the patient had a right carotid angiogram under general anesthesia. This showed an aneurysm of the internal carotid artery just proximal to the bifurcation on the right. Prior to surgery on 11/13/75, the patient had a normal urinalysis, normal chest x-ray, normal protime, normal CBC, and normal SMA 6+12, and normal electrocardiogram. On 11/13/75, the patient was taken to the OR and the aneurysm 1 was cleared, and the second aneurysm was discovered on the supraclinoid portion of the internal carotid artery on the right, and this aneurysm was wrapped with muslin. Okay, now all of a sudden, Dr. Klein is claiming in his dictated report that the Mount Sinai angiogram only showed one aneurysm, the larger one. They clipped it, and then they discovered the smaller one during the operation. The implication of this is, well, since it allegedly didn't show up in the angiogram, it didn't have a neck and couldn't be clipped, although he does not say that. He merely says it was discovered and then wrapped with muslin. Again, he gives no legitimate reason whatsoever as to why it wasn't clipped. Discovering an aneurysm during an operation is no legitimate reason for not clipping it. Legitimate reasons for not clipping it might be if the neck was too small or if it was too close to another artery, and clipping it might block the flow of blood through the other artery. Those are legitimate reasons, but neither surgeon mentions any of that. As a matter of fact, in the 3 reports that reference the operation, Dr. Holland's report, Dr. Klein's handwritten notes, and this dictated report, neither surgeon gives any legitimate reason whatsoever as to why the smaller aneurysm hadn't been clipped. Now, we know this report is bullshit. Dr. Klein, in his own handwritten notes, listed 2 aneurysms as a preoperative diagnosis, so him claiming that the angiogram showed 1 is nonsense. Furthermore, it's procedurally backwards. It couldn't have even happened this way. They went in through the right frontal part of the head. Well, and they're using an operating microscope. Since the smaller aneurysm was further up on the artery than the larger one, they would have had to see it first, period, whether they knew about it in advance or not, because they're using the microscope, and with the microscope, it's as big as daylight. Second of all, Dr. Holland clearly states in his report that they wrapped the smaller aneurysm first. Dr. Holland's report is technically and procedurally correct. They have to treat that aneurysm first. As I mentioned earlier, if they don't, then they just go ahead and clip that larger one, and there's a second aneurysm further up on the artery, they can cause it to rupture right on the spot. So Dr. Klein's report is anatomically incorrect, is a blatant falsification, has numerous falsified statements in it, and couldn't possibly have happened the way it happened. Plus, he left out Dr. Wancy, his last name, in an obvious attempt to protect him. So first, Dr. Klein files a falsified discharge sheet where he fails to mention the smaller aneurysm, and now he files a falsified medical report claiming that the angiogram showed 1. They discovered it during the surgery, his procedure is backwards, and all of a sudden he forgets the intern's last name. Now I want to show you another thing about Dr. Holland's operative report. Down at the bottom, you'll see he dictated it on September 29th, 1976. This is 10 months after the operation. 10 months after the operation, nobody at Mount Sinai Hospital was keeping track of Phyllis. She was completely forgotten about. So that means between September 6, 1976, when Dr. Klein filed his falsified report, and when this report was filed on September 29th, Dr. Klein's was the only report in the file. It's also obvious nobody at the hospital read it. Dr. Klein's report is an obvious falsification that anybody, you don't even need any major medical knowledge to realize it's nonsense. And if you have anatomical knowledge, you know it's total nonsense. But the fact of the matter is, the reports by these doctors are supposed to be reviewed by other neurosurgeons and other doctors who know what they're doing. But it's clear nobody reviewed any of this nonsense, that's for sure. I mean, these doctors are falsifying, lying to people, fully documented in writing, and nobody caught any of this at Mount Sinai Hospital. Now I want to take a look at Dr. Holland's office journal. This has Phyllis checkups. This is the first page. Okay, as you can see, Phyllis went to see Dr. Holland various times. Now let's take a look at the June 29th, 1977. Now we were married in June 4th, 1977, so this is just slightly after we were married. He says on Dilantin bi-daily. Dilantin is an anti-seizure medication, and Phyllis was in fact on Dilantin. Gums swollen at times. Neurologically okay. Then he says stop Dilantin, and he puts RX Mycilin 250 milligrams bi-daily, 8/22/77. Mycilin is another anti-seizure medication. It's a more powerful one. This is another falsification, compliments of Dr. Holland. On August 1977, the only medications Phyllis were on were Valium and Dilantin. That's it. The Mycilin prescription was in fact prescribed in January 1981. I know this for a fact because in January 1981, Phyllis had an attack of pains in her head and neck. I called Dr. Holland. He said it had nothing to do with the surgery. That's when he prescribed the Mycilin, and that was the only time he prescribed the Mycilin. Phyllis had a bad reaction to it. I called Dr. Holland back. He told her to go off the Mycilin and to go back on the Dilantin. So this is just a blatant falsification of his Mycilin. Apparently he doesn't want to put that he prescribed Mycilin, such a powerful seizure medication, 5 years past the operation. So this is another falsification. Then when we go to June 4th, 1979, all of a sudden he says on one Dilantin daily, and you'll notice he whited something out here. Okay, there's a big space in there, so he whited something out. Then underneath it, he says, discontinued Dilantin, return 1 year. I mean, Dr. Holland is involved in making so many falsified entries, he's losing track of what the hell he's doing. Phyllis he didn't discontinue Dilantin at this appointment. Phyllis was still on the Dilantin. She was on the Dilantin until June 10th, 1981. Okay, now let's take a look at the last page. This has Phyllis's last appointment with Dr. Holland on June 10th, 1981. Phyllis went to see Dr. Holland accompanied by her mother specifically for the purpose of determining whether it was safe for her to become pregnant. So she's in his office, and here's what she told him. Complains of fatigue, neck, and RUE. RUE stands for right upper extremity discomfort. Nervous, right eye feels weak. Neuro okay, return 1 year. These are classic symptoms of a right internal carotid artery aneurysm, especially right eye feels weak. The Hospital Association sends out mailers today, says if you have any facial weakness, and they specifically mention your eyes, get to the emergency room of the hospital because it's symptoms of an impending stroke. So Phyllis is complaining to Dr. Holland of the symptoms of the aneurysm. Now, I called Dr. Holland in January 1981, as I mentioned, when Phyllis had an attack of pains in her neck and head. Dr. Holland knew from that conversation that the muslin had now become fully incorporated into the arterial wall, and Phyllis now had a single larger aneurysm than she started with. Dr. Holland also knows exactly how long it takes muslin to become part of the arterial wall, and he set this time bomb up for approximately 5 years because this is 2 months after the 5-year mark for the operation. So Dr. Holland knows that Phyllis now has a single larger aneurysm, and certainly after this appointment, he now knows that the muslin is now part of the artery, and all she has is a large aneurysm on her right internal carotid artery. He gave her an in-office neuro exam, touch your nose, touch your toes, how much is 1 and 1, and told her it was perfectly fine for her to get pregnant. Well, that is the worst possible medical advice a doctor can give to a patient that has a perianeurysm, because due to the pressure on the arteries from the pregnancy, that aneurysm is going to grow tremendously, and that is exactly what happened. Now, let's take a look at Dr. Bresnik's notes. Phyllis successfully became pregnant, and she gave birth in November 1982. This is just prior to her giving birth. She is full term. Dr. Bresnik consulted with Dr. Holland. You'll notice right near the top, there's an asterisk. It says, Berry aneurysm resected 1977, Mount Sinai, in parenthesis, Dr. Holland, no S since. S stands for symptoms. No symptoms since. And then if we go down to the bottom, consultation, Dr. Holland, neurosurgery, agreed to trial labor. Now, Phyllis was at first full term when this report was taken. Dr. Holland told Dr. Bresnik 3 distinct lies, and he made 3 major omissions. First, he told him he resected or clipped, it's basically the same thing as far as the berry aneurysm is concerned, that he clipped a single aneurysm. He told him when he operated on 2. He told him the surgery was in 1977, when in fact it was in 1975. By telling him this, he let him think the repair of the alleged single aneurysm was more recent than it really was. And he said the patient was showing no symptoms since, when in fact Phyllis was showing symptoms of the concealed growing aneurysm at our last appointment when she complained to Dr. Holland that her right eye was feeling weak. So those are the 3 major lies. And the 3 major omissions: he failed to mention there was a second smaller aneurysm, he failed to mention that he wrapped it with muslin, and he failed to mention that at the time of this consultation, Phyllis now had a giant berry aneurysm on her right internal carotid artery, and Dr. Holland knew it was there all along. So it's obvious from these medical records that what Dr. Holland was up to. He was trying to pull a nasty sting on the family and on the obstetrician. That aneurysm was so big it could have spontaneously ruptured at any time. According to the autopsy report, it had 3 variable-sized heads. That's how big this thing was. So the chance of it spontaneously rupturing were huge. The chance of it rupturing during the delivery were astronomical due to the pressure on the arteries. That's what Dr. Holland was trying to get to happen. He was on call during the delivery, and he was hoping to get a call from Dr. Bresnik that something had gone seriously wrong. Had that happened, the baby might have been delivered due to a cesarean, but Dr. Bresnik would have immediately called Dr. Holland, who would have showed up at the hospital. He would have sent Phyllis back to Mount Sinai Hospital, and no one would have been in a position to argue with him. And once there, he would have been able to cover up what he had done to her. Fortunately, the delivery only lasted 2.5 hours and everything went well. After the delivery, Dr. Bresnik called Dr. Holland, and Dr. Holland was undoubtedly very disappointed to find out that there were no problems during the delivery. Now, let's take a look at medical records that Dr. Holland submitted to IDS Life Insurance Company. Right after the baby was born, Phyllis and I applied for life insurance policies. When somebody has a pre-existing condition, they make a note on the application to contact their doctor. The life insurance company will then send the doctor a cover sheet that he fills out, signs dates, makes any notes on, and attaches his medical records to. He then sends it back to the insurance company. The insurance company will then send him a small payment for his time. In those days, it was around $25. They'll mark the cover sheet paid and file it away. Well, when Dr. Holland submitted his medical records, I don't have the cover sheet scanned in here, but it was on December 13th, 1982. He sent in his medical records, and here's what he sent in when he sent in a copy of Phyllis's checkup sheet. This is her last appointment on June 10th, 1981. Complains of fatigue, neck and RUE discomfort, nervous, right eye feels weak, neuro okay, advised CT scan, return 1 year. Well, as we just reviewed, the original copy, which was sent to me on March 19th, 1984 by Dr. Holland's secretary, it does not say advised CT scan, and Dr. Holland never advised one. This document was sent to the life insurance company on December 13th, 1982, a year and 4 months prior to me getting the original copy. Now, this is an obviously falsified document. In order for Dr. Holland to have created this document, he had to have Xeroxed his original, wrote an advised CT scan on the copy, Xeroxed it again, and sent it off to the life insurance company. Now, why would you write advised CT scan? It's obvious. Phyllis complained to him of the symptoms of the growing aneurysm. What would a doctor do if a patient complained to him of these symptoms? In those days, he would advise a CT scan. So that's why Dr. Holland falsified this document, to make it look like he was providing legitimate ongoing therapy. As a matter of fact, I spoke to the claims examiner after Phyllis passed away. They apparently did no further checking. They issued an unrated life insurance policy on Phyllis. The claims examiner told me that the operation was so long ago, from this point it was 7 years prior, they figured she had to be cured. And that's what everybody else thought. Little did they or anybody else know that at the time they issued the life insurance policy, that Phyllis had a giant berry aneurysm on her right internal carotid artery. Now let's take a look at the autopsy report. Giant berry aneurysm, right internal carotid artery ruptured. That is the official cause of death. After I got this report, I spoke to Dr. Harupian, the neuropathologist that performed the autopsy and determined the cause of death. And he explained to me the time bomb effect of the operation. He told me, well, actually, the first words out of his mouth are, "Why are you doing this? I don't like to testify." So he obviously knew exactly what these doctors were up to. And I told him that, for all these years, we were told Phyllis had a single aneurysm and she was completely cured. Now, all of a sudden, she literally drops dead on the spot. I called Dr. Holland, only he died 5 days prior. And it turns out she has 2 aneurysms that we didn't know about. So I wanted to know what the cause of death was. That's when he explained to me the time bomb effect of the operation. The clip cured the larger aneurysm. It put pressure on the smaller aneurysm, and muslin became part of the arterial wall. In other words, Dr. Holland's operation is designed to create a single larger aneurysm years later that the patient doesn't know about because Dr. Holland concealed its existence. Based on the medical records, the patient, her family, and her personal physicians were told she had a single aneurysm that was clipped and she was cured. Anybody at Mount Sinai Hospital, such as the consultant that knew about the 2 aneurysms, were told they had both been clipped. So the only individuals that knew that they had left her with one of the aneurysms were the 3 neurosurgeons. This is what Dr. Holland was up to all along. Now, I called him on March 19th, 1984, the day after Phyllis lapsed into a coma. If he were alive, he would have showed up at St. John's Hospital in Queens. He would have sent Phyllis back to Mount Sinai Hospital, and once there, he would have been in a position to cover up what he did to her, working in conjunction with his associates at Mount Sinai Hospital and Mount Sinai Medical School. We know he had at least 2 other surgeons, and he probably had a hell of a lot more, because he didn't start doing this type of malicious medical activity on the first 19-year-old young woman that walked in the door in 1975. They were premeditated and fully entrenched in it. That means this was an ongoing thing. He had to have other neurosurgeons. He had to have neuropathologists working with him for the cover-up. And he probably had neurologists and a whole bunch of other doctors out of Mount Sinai Hospital and Mount Sinai Medical School working in conjunction with him to get away with it from start to finish. Remember, the only reason this was even found out is because Dr. Holland died 5 days before my call to his office came in, and I was able to get the medical records and have an independent autopsy done. So, as you can see, the medical records tell the entire story from start to finish. Not only that, we know from the medical records that Dr. Holland had to have performed various other malicious acts and lied to other people. Since he lied to the consultant, that means he had to have lied to Dr. Anton, the radiologist. He had to have told him he was going to clip the aneurysm before the surgery and afterwards. He had to have lied to Dr. Carlin, told him, the referring neurologist, and told him he clipped the single aneurysm. So there were a lot of other fraudulent malicious acts perpetrated by Dr. Holland that we can safely assume he had to have done. Now let me just go through a general synopsis of what exactly Dr. Holland did and what the medical records we just reviewed showed. Dr. Holland had a pre-operative diagnosis of 2 berry aneurysms, both of which had to be clipped to cure the patient. Dr. Holland told the patient and her family that she had 1 berry aneurysm and that it would be clipped and she would be cured. Dr. Holland, Dr. Klein, and Dr. Wancia performed the surgery whereby Dr. Holland wrapped muslin around the smaller aneurysm and clipped the larger one, thereby creating a time bomb operation. Dr. Holland told the hospital consultant after the surgery that he clipped both aneurysms. Dr. Klein filed a falsified discharge sheet that states a single aneurysm was clipped, and he does not mention the smaller aneurysm or the wrapping procedure. Dr. Klein filed a falsified medical report that states the smaller aneurysm did not show up in the angiogram and was discovered during the operation, and he also left out Dr. Wancia's last name. Dr. Holland filed his surgical report 10 months after the operation when the patient was completely forgotten about as far as the hospital was concerned. Dr. Holland denied the patient's symptoms 5.5 years after the operation have anything to do with the surgery, and he did everything he could to cause the wrapped aneurysm to grow larger. Dr. Holland consulted with the obstetrician 7 years after the surgery and told him that he resected a single aneurysm and the patient was showing no further symptoms from it. Dr. Holland falsified medical records 7 years after the surgery to make it look like he was providing legitimate therapy. And Dr. Holland was called when the patient lapsed into a coma and died due to a massive cerebral hemorrhage 8.5 years after the operation, but in this case Dr. Holland was dead and couldn't complete the cover-up. That's what the medical records tell.